Thank you for joining us today. My name's Ben Sims, and on behalf of THET, ACHEST and the Esther Alliance, a very warm welcome. In one sense, this conference is a celebration. The myriad ways in which the health partnership community has pulled together over the past year has been one of the most positive stories of the past year. Travel overseas may not be possible for most of us now, but the strong ties of trust, collegiality and professional respect built up over many years of collaboration are alive and well in these partnerships. We'll hear many examples today, but I also hope you've had a time to read the COVID synthesis report, which many of you kindly contributed to. Today, you will have the opportunity to reflect on what has been achieved by the health partnership community since our last conference in April, and to look to the future, recognizing the immense pressures that is now falling on health workers in every country. I'm delighted that this conference is being organized by THET in partnership with the Esther Alliance and ACHEST. This gives us a more European and a more African outlook than our previous conference. We are here to celebrate, but we are also here to express our urgency and our anger. 2021 is not the same as 2020, not least because we will never look at the world in quite the same way. We've been reminded about inequality, about racism, about the underfunding of health services, and the effects of this syndemic, to use the Lancet's favorite term, continues to be felt, continues to spread, and it's important to look afresh at how we are pulling together as a community when solidarity is more important than ever. We meet to argue that every health worker has the right to be properly equipped and properly supported, that every health worker in this world, every citizen, has the right to be vaccinated. We meet with humility, recognizing that we have much to learn from each other, and in solidarity, recognizing the power that comes from communicating as a global community across borders. As of yesterday, there had been 120 million people infected worldwide, and over 2.6 million people have died. In my own country, the UK, we are approaching 130,000 deaths. In these statistics is the story of what is happening to health workers, the story that we want to explore at this conference. In the UK, for example, over 850 healthcare workers are thought to have died of COVID between March and December 2020. Therefore, I think that it is appropriate that at the very start of this conference, we fall silent for 1 minute to remember the colleagues, patients and family members who have died over the past year.
Good morning.
Okay, thank you. Today, we have 48 speakers, 370 delegates and growing from 44 countries, organized across 4 streams of inquiry. It's a fantastic turnout. Thank you very much. But first, we open with a series of keynote speeches that will give context to our conversations. The first speaker will be Judy Canola from the University of Global Health Innovation in Rwanda. And Judy's going to talk about the challenges sub-Saharan Africa is facing. Then we will go to hear from Dr. Shams Said of the World Health Organization about the global response we need. Then we will hear a personal perspective from Dr. Saleha Hassan, an NHS emergency medicine doctor and filmmaker. And many of you will remember Shams and Saleha from last year. And then finally, we will hear from Dr. Bernard Brown from the Federal Ministry for Economic Development, Cooperation and Development in Germany. Thank you in advance to each of them. Judy, the stage is yours.
Thank you, Ben, very much for this opportunity. And my name is Judy Haniola. I'm the chair for the Center for Nursing and Midwifery at the University of Global Health Equity in Kigali, Rwanda. And I'm here to talk about COVID in Africa, but really mainly focusing from my perspective as a nurse and from the perspective of nursing. Thank you very much, colleagues. And I will start my presentation. So when we look at COVID in Africa, we want to talk about what's the challenge we face. And again, the perspective is from nursing and midwifery. Very quick overview. I could not attempt even to do justice to this, but Africa is home to more than 1 billion people. It is composed of low, lower middle, upper middle, and high income countries. And 13 of these countries are fragile or conflict afflicted. Africa is a diverse continent, and it has vast human and natural resources. Quick COVID picture. As of March 8th, 2021, the number of confirmed cases of COVID in Africa were slightly over 4 million, and this represented 3.4% of the infections around the world. Like I said before, Africa is a huge continent, and I can't attempt to do justice of the 55 countries that make up Africa. So this is just a snapshot of the number of COVID-19 cases in Africa as of March 8th by country. And here, like I said, we have a total of slightly over 4 million. South Africa is the highest with slightly above 1.5 million cases, followed by Morocco, Tunisia, Egypt, Ethiopia, Nigeria, Libya, Algeria, and so on down the line, right up to the bottom. This is just, again, a screenshot of WHO African region in terms of COVID, and it's just showing us the numbers. We have 2.9 cumulative cases, 9,336 new confirmed cases. Again, this is as at yesterday when I was looking for this information, 18th of March, and we have, we have different countries, of course, which are affected. On the right-hand side of me, Ethiopia having 1,704 new reported cases. South Africa has 1,500 new reported cases. Kenya, 1,200. Botswana, Gabon, and so on down the line. And just a quick snapshot of Africa. The darker red shows the countries that are harder hit than the lighter red. How has COVID then affected Africa? The continent, as I think most of us know, has far lower figures in number of cases and deaths in comparison to Europe, Asia, and America. However, the pandemic continues to still take a huge toll on African lives and economies. And actually, the economic activity is projected to decline by 3.3%. This is in 2021, a situation which could push 40 million people into extreme poverty. COVID has caused unprecedented societal and economic disruptions, like I'm sure all of us have experienced, not just in Africa. We know that populations are being severely impacted because of the measures that have been taken to curb the pandemic. So countries like here within, literally here where I sit, this eastern central part of Africa, our borders are closed, our schools are closed, there's restriction of travel, there's restriction of trade and mass gatherings, and there's also restriction of worship, for people in terms of reduction of economic productivity and public services. And again, these have also affected social lives, because things like going to church, funerals, weddings, and so on, the things that make up the fabric of society, have also been severely curtailed. What has Africa's response to COVID then been? It's been varied. The initial response was swift, and most of the countries, again, I'm speaking from within this particular region where I sit, East Central Southern Africa, and a little bit of West Africa, the response was swift. Countries like South Africa, Ghana, Kenya did initially have a swift response, and they took what was called a whole of government approach, where they they first worked to curtail importation of cases. Like we know, the first case was reported out of China in Wuhan. And so, they tried to quickly close the borders and curtail that importation of cases. And any case that was found was then identified and worked to contain them. There was efforts around care for the sick. And then many countries worked to cushion the impact of those lockdowns on the economic and social life. So many of the countries were giving out food or sending money. Like in Kenya, they sent through M-Pesa some amount of money to people on every bi-weekly basis to cushion that. And also many countries also work to boost domestic production, to deepen self-reliance. So there was a lot of innovation that came out around, even developing ventilators, producing masks and PPEs internally, because most times Africa sources a lot of these things externally. Some other countries were a bit slower to respond, and unfortunately still others denied the science around COVID. Unfortunately, like we have learned in the last 2 days, with very detrimental and sad consequences. Come 2019, 1 year down the line, these containment measures have really succumbed to the pressures of time and limited resources. And of course, we know, despite all the containment that was initially done, COVID now became, spread through community spread, and, it has gone like wildfire around the populations. There's been a lot of effort around syndromic surveillance and case finding. We have scaled up molecular testing capacity. Some of the countries initially had only like one, laboratory able to do molecular testing, and some countries like Ghana, they scaled up from 1 to 9 in this short period. We've deployed trainees in the field of epidemiology to lead field response. And of course, using our most precious resource, our young people, we've undertaken a lot of contact tracing. And so the response in Africa has been marked by innovation and resilience in the face of these insurmountable odds. And I always just like to be positive and say, as always, Africa will survive. I turn my lens now to nursing and midwifery and COVID in Africa. What is the challenge that we face? I start by saying to be a nurse and a midwife means to be of service, no matter the circumstances. And so this means that the largest health workforce in Africa is at the front line. Very high risk of contracting the disease. And unfortunately, in the last year, many nurses and midwives have lost their lives. In Africa, often nurses and midwives are the first and only health professional people will see. And so the role that they play is critical. Prior to COVID-19, we already had a severe shortage of nurses and midwives, and this has been further exacerbated because of COVID, resulting in even poorer service delivery and more suffering for the African peoples. Management of population health has taken a back seat in the fight against corona. I think I'm not on slide show. Sorry about that. Screening, for example, cervical cancer, which often many times it's only nurses and midwives who do this. Things around communicable diseases, for example, TB and HIV, malaria, immunizations, especially childhood immunizations, conditions affecting newborn babies and their mothers, primary and community care, disease prevention and health promotion, and infection prevention and control, all of which sits squarely with nurses and midwives, has taken a back seat in this fight against corona. Nurses and the COVID response in Africa, I'll just talk about 4 specific areas. At the clinical and health facility, of course, this is where many people come for care and where, we are looking after sick people. And of course, this has been characterized by inconsistent, inadequate PPE and hand sanitizers. A lot of the health allowances that were promised at the beginning of COVID last year have not been paid. And many countries have had strike action. I'll give case in point, Kenya, Ghana, they've had a lot of strike action. The second point has been children and school, and here now I'm speaking in 2021. Last year, many schools closed, both at the primary, secondary, and tertiary level, and they've tried from January this year to have schools open, and this, of course, requires routine surveillance of students, again, most of the time falling on nurses and midwives. In fact, we've seen a lot of pockets of COVID coming up at campuses, and some of the countries are actually looking at perhaps thinking they'll close down. Here in Rwanda, they had opened and then they closed again. So again, this has been an effect of COVID, and where nurses, of course, squarely play a hand. When we look at workplace protection, we're looking at management of employee infections, and of course, right now at vaccines, we need to roll out mass population vaccination. Again, all of us, I'm sure, who've gotten the jab, the person who jabbed you was a nurse. However, turning the tide can happen. And for me, I will beat the drums for nurses and midwives. We are at the heart of turning the tide against COVID-19, because again, for us here in Africa, we often are the answer, or can be the answer, or can support the answer to challenges Africa is facing. One, we know limited resources that Africa often faces. So we know that nurses and midwives are a cure or a panacea to this, because they live and work in the communities. They are many, they are large, in numbers, and therefore can work towards mitigating the limited resources through the work they do in prevention, promotion, and even working in the community. Of course, we've seen that there's been a lot of poor policy implementation because of the poor global cooperation that has been used to fight the pandemic. A lot of insular, a lot of, you read stories around many of the countries in the global north unwilling, for example, to sell or give out the vaccines to other less endowed countries. And so this has resulted in poor policy implementation at national level in countries in Africa. And again, like I keep on saying, nurses stand firm, stand steadfast, because they're in the community, they're working right next to the people, and this policy that happens at higher levels does not mitigate the fact that the nurse will continue to do what she does, despite the gurus up there playing there and doing their shenanigans. Limited data collection, inconsistent health system supplies, like I mentioned earlier. We have very bad public examples. I know, for example, in Kenya, my own country, politicians have been politicking, and super spreader events have happened there, which has really worked against the fight against COVID. And again, I say nurses are always at the front line of giving out accurate information to the public. And of course, an information vacuum has been created by poor communication, which has again resulted in explosion of myths and inaccurate information being sent out to the public, again, which nurses work very well to mitigate. Colleagues, I thank you.
Greetings, colleagues. Thank you so much, Judy. My name's Sham Saeed, and I'm really delighted to be with you today to share some thoughts with you, hopefully reasonably briefly. First of all, I just wanted to check whether you can see my screen. I'm assuming the silence means that you can. Okay. So Today, as Ben has highlighted very clearly, the focus is looking afresh at how the institutional health partnership community can respond to what we face throughout the world. And Judy very nicely placed the epidemiology from the African continent in front of us. Just looking at the numbers, the first thing to highlight is that the numbers never do justice to the reality that human beings face. So the same number that Ben mentioned, 120 million, 2,674,078 deaths. This is the information coming out from last night. Now, we do recognize and appreciate the suffering involved in those numbers. But then when you turn to that additional number in the last sentence of 363 million plus vaccine doses being administered, we see the hope that is emerging. I'm going to just share just a number of points. There's 5 things that I'd like to share with you today in terms of how I believe the institutional health partnership community can really change for the better where we are in the world. The first point is the importance of tilting institutional health partnerships, tilting those well-rounded partnerships, often long-standing, to co-develop solutions for immediate needs. And what do I mean by that? We've seen some really amazing examples of institutional health partnerships that are responding to issues such as infection prevention and control, clearly at the heart of COVID-19 issues. And this is what we're seeing when colleagues are struggling on either arm of the partnership. And this is where the point around the solidarity between health workers across continents really comes in strongly. I think many of us within the partnership community know this and recognize this and appreciate this, but it's something that we shouldn't take for granted. The tilt that we can do and have done within the institutional health partnerships can continue, and it does have to have immediate relevance and significance to frontline realities. And institutional health partnerships, when they tilt in this way, can be a channel for some of those really important technical areas. Just as an example, you see the core components and the minimum requirements for infection prevention and control documents, but the documents mean nothing unless they are, of course, brought to bear at the time. The second point that I'd like to make is that in our institutional health partnerships, there's the importance of remembering and working on quality of care at every step, in every setting. Very interesting to hear Judy's description of the different settings within the African continent. But we need to take stock of how quality of care is being examined and acted upon, both in stable settings and also in fragile, conflict-affected and vulnerable settings, which is the home to 2 billion of our fellow human beings. Again, institutional health partnerships can be a channel for some of the technical know-how on this subject. WHO has 2 really important technical resources that have recently been issued. One, the Quality Health Services Planning Guide, and the second, the Quality of Care in Fragile, Conflict-Affected and Vulnerable Settings Taking Action document. Again, these documents, these resources mean nothing unless they are used at the front line. The third point is the importance of supporting vaccine rollout through the work of partnerships. And it was interesting to hear Judy mention the pivotal role of nurses, of course, hugely important. And the words of my Director General seem quite poignant here. It's the same nurse who vaccinates children and cares for new mothers that will also need to detect an unusual communicable disease. This was written back in 2018 and clearly has still significant resonance to our world today. What the institutional health partnerships community can do is really focus in on how a vaccine supply is then brought to bear for the population. And this is where vaccines meet health services. Institutional health partnerships can play a pivotal role in that, particularly in identifying bottlenecks and identifying where things can be improved. The fourth point, and I think the institutional health partnership community is very well placed to understand this concept, is to apply the compassion at every level. What do I mean by the compassion equation? One, awareness, so the cognitive awareness of suffering. Two, empathy, so an emotional resonance with the suffering. And three, and perhaps most importantly in the world that we are in today, action, commitment to alleviate that suffering. So often compassion and the discussion around compassion can sound soft, but it isn't. It's one of the most important components that we need to think about, particularly in the world that we are in today. And this expands beyond the health arena, for sure. And this is something that was also alluded to in Judy's description of how the situation is affecting lives in totality. There's lots more to say on this, and it's really great to see that this conference today is taking on this theme to examine together. And in order to learn more, I'd encourage you all to have a glance at the Task Force for Global Health web link, which provides a lot more information. Finally, my fifth point is that we really need to learn with humility. The learning that the partnership community has already within its grasp can have a huge impact on others. WHO has recently initiated a health services learning hub for maintaining essential health services in the context of COVID-19. This provides an opportunity to really unpack some of the experiences of institutional health partnerships as they pivot towards maintaining essential health services. And again, this is something that we heard very clearly from Judy. There's a real issue in tackling COVID-19 cases, but there's a hugely important area. How do we maintain essential health services? And when we talk about health services, how do we maintain promotion, prevention, treatment, rehabilitation, palliation? All of that continues. All of that needs attention. The institutional health partnership community can provide support that's required for that attention. Thank you very much. And I'd like to just end with reminding ourselves that we are still very much focused on meeting the Sustainable Development Goals, even in the midst of what we face today. It may never be more important than it is today to really focus in on the interdependent Sustainable Development Goals and not forgetting the 5 Ps: prosperity, people, planet, peace, and partnerships. And often we forget those 5 Ps. Those 5 Ps were foundational in the SDGs. We often gravitate towards the 17 SDGs, but let's remember the 5 Ps and the 5th one, which is partnerships. Thanks for giving me this opportunity to share a few thoughts with you. I look forward to hearing from Dr. Zelaya.
Okay, thank you very much to both Judy and Shams for their talks. I will just now create the share screen. And I will play my presentation. Okay. So I'm going to talk from a personal perspective of being a healthcare worker within the UK during the pandemic. I've put up a picture of my college at Cambridge because it's wishful thinking. That's as close as I've got to it this year, over the last year, because obviously all universities were closed as well. So I just put that up for nostalgia. So a little bit about me. So I'm an emergency medicine doctor. However, I've spent the last year working in intensive care, both because it was when I was supposed to be doing it. It just was my time to work in intensive care, but it fell within the COVID pandemic, and the experience has been something I will never forget. I am also a filmmaker. And as I mentioned, I'm doing a PhD at Cambridge looking at the impact of attacks against healthcare in conflict zones, both prior to and during COVID-19. I do have to say this from the word go. Partnerships, as Shams was saying, extremely crucial. And I think now more than ever, we are going to have to be really innovative about how we move forward in terms of partnerships facing not just the pandemic, but other global health challenges. We know that within the UK, we are facing a 0.2% cuts in the UK aid budget, which funds very important projects across the globe in the developing world, where many of them are health related. Now is it feels a really precarious time to be making cuts in these budgets. The argument is that there is a domestic need for finances. Like many countries, the UK has faced challenges financially in the COVID response, but we are now facing a significant cut in a budget that is going to lead to us, and I say us, people who are here today, people who are involved at all levels of global health and who believe firmly in equality of healthcare globally, across the developing world, across the global north and global south. We're going to have to think harder than ever before. These are not my words. I thought it was really interesting that Lord Edward Garnier has actually said that such a cut would be unlawful without going through proper legal routes. So it remains to be seen what will happen. We can be optimistic and hope that such a move won't happen, but I felt it really important to bring this up. And what is even more worrying, and healthcare workers, global health researchers, academics across the UK are also quite concerned that at this time where innovation, where research, where working together in collaboration in dealing with the pandemic is more important than ever. Global health research funding in the UK is facing a threat which could lead to £120 million funding gap, which someone was comparing that to the fact that we have spent 23 billion at least on the test and trace system here in the UK, which at times was controversial. I'm speaking diplomatically, versus £120 million funding gap in some essential research where now is more important than ever. But I felt really strongly about raising those issues so that when we go ahead today, we are thinking outside the box and thinking creatively and innovatively about how we can all work together. One of the ways that I work is I try to advocate. I think healthcare workers are important, crucial advocates of what they see on the ground. Judy talked about the crucial role of nurses. I absolutely echo that, absolutely do. The issue is that often the healthcare workers are tied in with the tasks that they are doing, and they often don't have the time or the energy to raise their head above the parapet to say what is going on. And it is left to those who really don't understand what's going on at ground level to make the decisions, to interpret what they think is going on. So in a way, the way that I tackle that, yes, I work clinically, and for me, continuing to work clinically is crucially important, and I hope I will continue to do that with whatever else I do, because it is the only way I stay connected with the reality of what is going on the ground. Otherwise, I do not feel I have the right to comment otherwise. So that is why I continue to work, and that is my impression. And the insight that I have had over the last year compelled me to try to make a film about the situation, and I was lucky enough to get a commission to make a film, a documentary about the situation facing staff and patients within my hospital. I knew that we were definitely in a different world to one that I'm used to, because frankly, my filmmaking often involves going over there somewhere, you know, to an austere setting. My filmmaking and humanitarian health related work has often been on deployments overseas. COVID has now humbled us and has brought the situation home. So this time I wasn't packing my bag, taking my passport, flying overseas. I was literally just getting in my car and driving to my hospital. I want to show you a quick 3-minute clip of the film. I think that will better describe what we are facing rather than me just talking about it. Under more pressure than ever before, I've been with them in the heart of the COVID storm.
I find it hard. I think any nurse didn't cry for majority of the afternoon.
The huge emotional burden on frontline staff has brought them close to breaking point.
Some of these nurses here, they've been in here and it's now their 3rd night in a row. They're starting to develop pressure sores on their face and they just need time.
I think that long term, a lot of staff will suffer with PTSD, having seen what they've seen.
I'm certainly worried about the impact of all of this on my colleagues. But while filming, what I never expected was the story would include my own personal crisis. I am bedside looking after my dad, who is very unwell with COVID, and watching my dad not being able to breathe, the panic and the terror is the most terrifying thing. One of his designated carers, I'm lucky that it's the hospital's policy to allow me to be by his bedside. I am so frightened. What's worse is knowing that he will be frightened. My dad, Ahsanul Haq Chowdhury, came to the UK in the 1950s from Pakistan, and I'm one of his 6 children. All of us ended up working for the NHS, 5 doctors and 1 pharmacist. You know, we stayed away because we had to make the choice of doing our job looking after patients during COVID or staying with my dad. And we chose to look after patients. On December the 28th, after 7 days in hospital, my dad died.
The things we've seen today, I'd never wish that on not even anybody, let alone your family. It's hard, yeah.
Despite everything we I felt that will demonstrate better what the front line looks like, and I think we have all been unified globally with our experience in a way that I never imagined that we would. during this filmmaking process, we did a survey interviewing up to 2,000 nurses, and I really was heartened to hear what Judy was saying about nurses being absolutely, you know, a crucial part of turning the tide with COVID. Yet within our documentary, we found that 75% of all NHS staff faced abuse, especially during this year of COVID. I would talk about the pandemic here from March last year to now, and 86% of those were Black, Asian and ethnic minority nurses facing abuse coming to work. I think that was shocking, and that sort of really makes me think about my PhD, and that maybe I should be turning my attention to the abuse that's being faced at home before looking elsewhere. And the other fallout of this is the mental health impact, and I think one feeds into the other. We need to tackle the abuse issue in order to care for the physical and mental well-being of our healthcare workers through COVID. This is my contact. I will stop now, but I'm very grateful for your time, and if you have any further questions or would like to see the film, it is on the Channel 4 website, and I will share it with the organisers in case anyone wants it. Thank you.
Good morning, ladies and gentlemen, and thank you for giving me the opportunity to speak to you. And I must say this is a difficult task after this very touching and thoughtful film, and it is even more difficult in digital times to share, but it's very difficult to come up with a speech after this very touching movie, and I want to send out my sympathies to you for your loss. My name is Bernhard Braune. I'm head of division at the German Federal Ministry for Economic Cooperation and Development, head of division for global health policy and finance, and I've come here to send you my greetings and congratulate you on your work as an international partnership on healthcare workers and hospital collaboration. I want to thank you for letting me join the conference, and I want to thank the organizers and my co-speakers for their thoughts and sharing their experiences in the Alliance. I want to give you a short overview of what German development cooperation has brought to this Alliance and where we see the international situation around COVID-19, and also what the German development cooperation, but also overall the German federal government has participated in the international fight against COVID-19. First of all, my three speakers already described the situation that COVID-19 is letting us tackle, and it is a very severe health crisis, but it's beyond that economic and social crisis. And for us, it is the key lesson that only a medical intervention on a global level can really put an end to that pandemic. And of course, for such medical intervention on a global and universal level, we need strong health systems, and the center of any health system are healthcare workers. So this is for us the crucial element in this situation, that we can only stop the pandemic if we provide healthcare workers with the tools they need to care for patients, to vaccine, but also to protect and to cure. if I may say that as a son of a nurse and youngest brother to 3 healthcare workers, I'm a little bit, as a lawyer, the misfit in the family, but I can share with you that I'm very aware of the stress and the challenges healthcare workers are under. And so I'm speaking about this not only from a academic or technical point of view, but also from a very personal point of view. So the vital role healthcare workers play is for us very key in tackling the pandemic. The German Ministry for Economic Cooperation and Development has rapidly mobilized additional funds to react to the COVID-19 crisis, and the partnerships that we already had established were extremely important to make these additional funds come to use as quickly as possible. I would like to mention a few examples of projects with German doctors, nurses, lab technicians, and other health experts that have engaged in the fight against COVID-19. So, for example, the German Global Hospital Partnership Program, which is part of the ESTER Alliance, has launched in 2020 extraordinary funding of 4.5 million euro. And this made it possible to support more than 20 additional partnerships in 17 countries in Africa. And we're very proud of this, and we're very happy that, again, we were able to rely on existing partnerships and could strengthen them and support them in their fight. At the end, I also want to mention what we have done on a global level, just to give you an overall picture of our political engagement. The German government at the UK G7 summit on February 19th, sorry, pledged another 1.5 billion euro to support the global medical platform in the fight against COVID-19, the ACT Accelerator, Access to COVID-19 Tools Accelerator, which is organized under the great leadership of the World Health Organization. And we're very proud that we are at the moment the globally largest funder of the ACT Accelerator. Most of the funding that Germany provided to the ACT Accelerator will go to the vaccine pillar of the ACT Accelerator, the COVAX facility, because we see the urgent need of vaccine as many people as quickly as possible worldwide. And COVAX is doing a great job in delivering vaccines now to as many people as possible. 30 million doses have been delivered since the start in March to over 45 countries already. We know this is maybe too little, too slow, but we are still proud that this largest worldwide vaccine movement is on the go. COVAX plans to vaccine at least 1.3 billion people, and this is the largest vaccine endeavor ever undertaken. And we are proud to be part of this, and we are proud to be one of the core funders of this. In concluding, I want to thank you again for your participation in this platform, in this international partnership. I want to applaud you for your work, for your hard and important work. I want to thank the partners that organized this conference, and we look forward to continue the German engagement in this international partnership. Again, everything we do in development cooperation needs to be implemented in partnership. And for that, we need strong and solid actors on the ground, and especially in the health sector. These are healthcare workers like you. And therefore, I thank you for your continued work and wish you best of luck with this conference. Thank you very much.
Bernhard, thank you so much, and congratulations on all that Germany is doing to respond to the syndemic around the world. It's wonderful to have you with us. Thank you.
Thank you very much.
Salea, I can't move on without acknowledging your loss and saying how sorry we are for your loss. It was a very moving film. Thank you for sharing that and for sharing what is obviously a very personal experience.
Thank you.
And Shams, I'm so pleased we'll see you again at the end of the conference when we have our panel discussion. And I know you'll have a chance to meet Judy also in some of the breakouts. So we will move to have a short pause now before we return for the breakouts at 10 o'clock. Just to say a few things. Enjoy the networking lounge. We've got wonderful technology that we're using on this platform, so you can seek each other out and network on the platform. Please use the COVID partnerships hashtag on Twitter. Some of you already are, but the link, for example, to the documentary made by Salea has been put there under COVID partnerships. You'll be glad to know that if you're missing a session, you'll be able to watch the session later on. So the whole thing's being recorded. And we're also aiming for a conference report. So we're documenting everything with a view to writing it up and making that available to donors and others. The final thing I want to say is that today we're launching Pulse, which is a global community platform that enables health workers to connect, create and collaborate with each other. And you'll see links to Pulse on this platform. Have a good conference, everyone. Thank you so much to our opening keynote speakers, and see you all again at 10 o'clock.
Thank you, Ben.
I'd say 10 o'clock, I mean 10 o'clock UK time, 11 o'clock German time.